What made you choose to work with patients who have food allergies?
As a young child, I was very allergic. I had asthma and I had food allergy to milk and egg that I outgrew. Later on as an adult, I developed shrimp and then peanut and tree nut allergies. So I really believe in using the therapeutic use of self to help others with a similar condition.
What is your personal experience with AUVI-Q?
So I've had to administer AUVI-Q on my daughter, Sophia, who was having an anaphylactic reaction. While she was not feeling well, obviously, and very concerned, when I administered, she said, "Mom, I feel better." So right away, it's a reassurance that you're doing the right thing. Our fear as parents is always, am I doing something that's gonna hurt them? But really what I tell families is we're empowered.
How can features like audio instructions impact patients?
When you're in the middle of a very uncomfortable situation, you can forget a lot of things. So having cues, visual cues, having audio cues that help us remember what we need to do, they're crucial during these moments. It really does help when you're in a scary situation to have a voice, a calm voice, walk you through the steps, and it's a reminder. And I've had patients say it really did help them during that moment.
If you could leave patients and families with one message about preparedness and action, what would it be?
First-line treatment of anaphylaxis is epinephrine, and we know that the sooner that we administer, it works. So the recommendation is having it immediately accessible, and as soon as the patient starts with symptoms, administer it. My one message is just being sure that you're carrying your epinephrine device at all times, having AUVI-Q available, and once you recognize the symptoms, just use it. Recognition and immediate action.
Why is advocacy, both self-advocacy and caregiver advocacy, essential in allergy management?
Advocacy is important from both standpoints because, especially when we're talking about anaphylaxis, the importance of recognition and then also realizing, okay, this is the moment where I need to administer epinephrine right away. And being a self-advocate is important, even for children, because they can help protect themselves, but they can also instruct others. And then as a parent or as a caregiver, being an advocate for the patient is always essential.
What advice do you give to new prescribers about managing food allergies?
When you're a new prescriber, I remember when I first graduated, you have concerns, but with food allergy, the one constant has been the treatment of anaphylaxis. The first-line treatment is epinephrine. So as a new prescriber, you are empowered to help the family by writing the prescription. It may take some time to get in with a specialist, and some patients may not see a specialist at all. So just knowing that you're doing the right thing by writing the epinephrine and helping the family so they'll be prepared in case of an emergency.
What excites you about AUVI-Q Speaks Up?
The opportunity to, again, promote the importance of advocacy, about recognition, about first-line treatment and being prepared. And not only as a patient, as a mom, but as a pediatric allergist.
Why are you speaking up about AUVI-Q?
I'm speaking up about AUVI-Q because it's important to be prepared, not only as a parent or as a patient, and just recognize the symptoms of anaphylaxis and act immediately.
What is AUVI-Q? AUVI-Q, epinephrine injection, is a prescription medicine used to treat life-threatening allergic reactions, including anaphylaxis, in adults and children who weigh 16.5 pounds or more who are at risk for or have a history of serious allergic reactions. AUVI-Q is for immediate self or caregiver administration. Important safety information. What is the most important information I should know about AUVI-Q? Always carry 2 AUVI-Q devices with you because you may not know when a life-threatening allergic reaction may happen. If a second dose of AUVI-Q is needed, it should be given starting 5 minutes after the first. If you need more than 2 doses of epinephrine for a single anaphylaxis episode, more doses must be given by a healthcare provider. Talk to your healthcare provider about when it is necessary to get medical care for further treatment of the allergic emergency after using AUVI-Q. If you have certain medical conditions or take certain medicines, your condition may get worse, or you may have more or longer-lasting side effects when you use AUVI-Q. Before using AUVI-Q, tell your healthcare provider about all of your medical conditions, especially if you have heart problems, high blood pressure, diabetes, thyroid problems, kidney problems, history of depression, Parkinson's disease, or are pregnant or plan to become pregnant, are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal supplements. AUVI-Q and other medicines may affect each other, causing side effects. AUVI-Q may cause serious side effects. AUVI-Q should only be injected into your outer thigh, through your clothing if necessary. Do not inject AUVI-Q into your veins, buttocks, fingers, toes, hands, or feet. If this occurs, go to the nearest hospital emergency room right away and inform the healthcare provider of the location of the accidental injection. Rarely, people who use AUVI-Q may get infections at the injection site within a few days of an injection. Some of these infections can be serious. Call your healthcare provider right away if you have any of the following at an injection site: redness that does not go away, swelling, tenderness, the area feels warm to the touch. If you inject a young child or infant with AUVI-Q, hold their leg firmly in place before and during the injection to prevent injuries. Ask your healthcare provider to show you how to properly hold the leg during an injection. Common side effects of AUVI-Q include fast, irregular, or pounding heartbeat, sweating, shakiness, headache, paleness, feelings of overexcitement, nervousness, or anxiety, weakness, dizziness, nausea and vomiting, breathing problems. Tell your healthcare provider if you have any side effect that bothers you or does not go away. These are not all of the possible side effects of AUVI-Q. You are encouraged to report side effects to Kaleo Inc. at 1-877-302-8847 or to the FDA at www.fda.gov/medwatch or 1-800-FDA-1088.